Well, May is Stroke Awareness Month, and today we want to give you some of the warning signs and some of the prevention things you can do. We're here at the Spartanburg Rehabilitation Institute in Spartanburg over off of North Grove, and we're here with Dr. Ryan Hudson. He's the medical director here to kind of talk about some of those warning signs and what you need to know to kind of prepare yourself. Dr. Hudson, thank you so much for having us in.
Thank you for being here.
Yeah.
May is Stroke Awareness Month, so we want to just let the audience know that stroke's a medical emergency. It's a very significant thing that can affect our patients. We use the mnemonic "Be Fast" with a lot of our patients to remind them about what a stroke might look like. And the B being balance issues, the E being maybe some visual changes with their eyes, F being facial weakness or numbness, and then the A including things with the arm, maybe some weakness of the arm, and then S, slurred speech potentially. At the very end of that, the T of the Be Fast is reminding us about time, that it's very critical for patients that might be having any of those symptoms to very quickly seek medical help, call 911 and get to the hospital as quickly as they can.
So Be Fast is a great mnemonic device for folks to, if they're kind of watching someone else go through that, or maybe they're experiencing it themselves, that timing is really important for some type of treatment.
You're exactly right. We found that, every several seconds that goes on, more and more brain cells are being killed because of the lack of blood flow from a stroke. And the faster they can seek medical attention, they can help prevent some long-term impairments from that. So just being aware of those signs and symptoms of you individually or a family member, it's very important to act on that quickly.
And stroke is something I've had to deal with. My biological mom had a couple of strokes, years and years ago. Yeah. So being in spaces like that you guys have here, the Spartanburg Rehabilitation Institute, you guys do a lot of work day in and day out to make sure that these folks are able to get back. Tell us a little bit about what happens here and what folks go through this process.
Sure. Spartanburg Rehab Institute, we were founded in August of 2013. We're a 40-bed inpatient rehab facility, so we have 40 private rooms. And patients that come to us, many of them have had strokes or other illnesses, injuries, hip fractures, COPD, respiratory heart issues, and they come here and they get very significant medical care and very good therapy services. So 3 hours of physical therapy each day, working with our physical therapist, occupational, and then some of them speech therapist, nursing that's around the clock coverage, and then a medical doctor will also see them daily as well. So the highest level of rehab care, a lot of good medical care, and the rehab side of it as well, to really help them functionally to quickly get up and start moving again, to help them become independent so they can hopefully get back home.
And state-of-the-art facilities here. It's my first time being in and seeing that there's a cafeteria, there's locker rooms, there's lots of open spaces. So you guys have done a great job of putting this all together.
Well, thank you. We have a beautiful therapy gym here. We have even specialized equipment, as you can see behind us here. And but it really comes down to our personnel. We have all of our people, compassionate caregivers as part of our kind of model, and we really want to do our best to see these patients get back to fully functioning and doing better in their life again.
And of course, with May being, like we said, Stroke Awareness Month, what are some things people can do to kind of prevent, getting to that? There's obviously some things that we can't control, but there are lots of things that we can.
Yes, I'm glad you brought that up. There are some non-modifiable risk factors, age, even genetics, which you kind of alluded to, but some of the modifiable risk factors can be controlling your blood pressure, your blood sugars, controlling your cholesterol as well, and then just trying to overall stay healthy, keeping your weight in check. If you are smoking, if you could stop smoking, that would be helpful for that. The more you can take control of those risk factors, also exercise, be careful with your diet with high sugar intakes. All of those really do help to lower your risk of stroke in the future.
Is this something that they're referred to by a doctor, or is this something that they can call you guys right now and say, I would love to kind of get signed up for some of these services?
Usually how patients end up coming to our facility is they end up going to the hospital with a stroke, they get treated, a workup there, and then a referral will be made to our facility. But we would love, if you have any questions, to call our facility and we can help to navigate how we might be able to help a patient that's been dealing with a stroke or some other medical illness that could necessitate an inpatient rehab stay.
And you guys are over here in the North Grove Medical Center area.
That's correct.
Really easy to find here. The information is on your screen. Well, we'll be sure to put it for you at our website, yourcarolina.tv. Dr. Hudson, thank you so much for having us in today, and thank you for educating us for Stroke Awareness Month. We appreciate it.
Thank you very much for being here.
Thank you.